Okay. First, Mark, thank you both for the kind introduction and for your incredible leadership on this issue for so many years, and for really setting the stage, I think, for this conversation. As Mark indicated, much of my work is tied to policy. Some of the data that I'll share with you and the things that I'm going to talk about may be a little bit frustrating to clinicians or others who have spent a lot of time focusing on clinical populations. I don't have a lot of those kind of data to share with you, and even some of the studies will only have an indirect mental health link. So I just sort of want to say that as we get going. So I'm posing the question with this talk about, can we save lives by limiting access to lethal means for those with mental illness? I'm going to start with what happens to be, at least on the intervention side or policy side, a sparse amount of data. Mark indicated that we held a summit last January. We brought together the best experts from around the country looking at all aspects of gun violence and gun policy. And we were lucky enough to have Jeff Swanson from Duke University and some of his team that led a very important study that's really the first one to take a careful and very solid scientific look at mental illness-focused firearm prohibitions and their impact on violent crime. Dr. Swanson and his team were able to obtain data from public mental health and criminal justice agencies in the state of Connecticut, a very large sample of over 23,000 individuals with severe mental illnesses. To get into this population study, diagnosis of schizophrenia, bipolar disorder, major depressive disorder, and yet have been hospitalized for those illnesses. They focused on two general cohorts. One had at least one of 4 potential mental illness disqualifications for purchasing or possessing firearms, and the others did not have any such disqualifications. This is a breakdown of the various disqualifying conditions within the sample who had been hospitalized for severe mental illnesses. Now, I should have underscored that this includes both voluntary and involuntary hospitalizations. The involuntary hospitalizations, if it's for the reasons of danger, will disqualify you from possessing firearms. And I'll take you to the bottom row there and note that 60% in this sample were not disqualified from purchasing, possessing firearms based on their backgrounds, based upon the state and federal laws applicable here. And only 7% were disqualified because of a mental health issue. Now, there's some overlap with those who were disqualified for having been convicted of various crimes. If you looked at, I didn't separate this in this slide, but it was only 5% of this overall sample who were disqualified only because of the mental illness disqualifications. So what Swanson and his colleagues did in this study in a very elegant way, and what's unique about this study is that basically all the other kind of policy studies I'm going to show you are population level data, and some of the laws you won't look at specifically who those laws apply to. You're just going to look at it overall population, is violence or suicide going up or down. But here, with having this individual level data, they could see whether the individuals involved were affected in terms of their risk for violent offending. And it was beginning in 2007 where the state, in essence, started putting the records in to make sure that those who were disqualified wouldn't be able to purchase a firearm. So after controlling for a variety of things in the backgrounds, the adjusted odds ratio was 0.69. Basically, that's a 31% reduction in risk for arrest for violent crime, solely because they were impacted by this reporting to the system. There was no change in the offending group that were unaffected by this reporting change to the NICS system. And basically, their offending rates became basically the same as those who did not have disqualifications. So I guess the other thing I wanted to point out about this that I don't think even the authors noted in their chapter is that on the downside, this is not gun-specific offending that they're looking at. On the other side is that if indeed this is a causal effect, it must be very large because probably 20% or so of the violent crimes are probably going to involve a gun. So if they're just affecting gun crime, they're having a pretty robust effect based upon this, this new study. I also wanted to point out, and so basically that's it in terms of interpersonal violence, of very specific mental health disqualifications, examinations of those policies, at least at an individual level. Now, there are studies that have looked at other high-risk populations and those populations include a fairly high prevalence of mental illness, and particularly in substance abuse, particularly with intimate partner violence perpetration. There have been a few studies that have examined the policies focusing on intimate partner violence perpetrators and found significant reductions in intimate partner homicide associated with firearm restrictions for those with restraining orders. Similarly, a study that was set up in an individual level, more like Swanson's study that looked at violent misdemeanors in California, found that their policy of disqualifying people with violent misdemeanors also reduced violent crime among those affected. So that's kind of the science as it relates to interpersonal violence. Much of the risk connected to mental illness and violence is really self-directed violence and its relevance to access to lethal means. So there's a fairly large body of research on this. I'm going to try to run through it quickly and hit the high points. I want to acknowledge that Matthew Miller and his colleagues at Harvard had really done incredible work in this field. So it's important to acknowledge and not always fully appreciate a full causal model for what produces a suicide or whether a self-directed act of violence ends up with lethal consequences. And it's not only the mental illness or other crises, but the method selection is critical. But what determines that? And this is really important when we're trying to think about the ability to focus on lethality of means and what that will do with mortality risk. If it's based upon how intent you are in killing yourself, then perhaps we're not going to get very far with that approach. But if it has more to do with cultural and general availability, then perhaps we can. Most people who talk on this subject always want to mention the British coal gas story, so I feel compelled that I'll do that too. For many years, most homes in Great Britain were heated with coal, and nearly half of the suicides at that time were people who killed themselves by putting their heads in the ovens, and it was referred to as an execution chamber in every kitchen. However, for reasons having nothing to do with suicide, concerns about suicide, the British government wanted to reduce pollution and went away from coal towards natural gas. And by the early 70s, there was no coal in the homes and suicides dropped by a third. So that might at least be suggestive. What you're looking at here is in the Washington, D.C., where we're located, and it's the Duke Ellington Bridge. You can imagine if you decided to jump off of that your risks for survival probably aren't particularly great. Because it was a particular hazard, a lot of people were killing themselves jumping off this bridge. The city put up a very high barrier. And so that sort of raises the question of, well, can't they just simply find another place? You know, piece of cake, right? Well, let's just briefly look at the data. So before they changed this barrier, that bridge accounted for half the bridge jumping suicides in the city. The almost identical type of bridge, the Taft Bridge, had about half as many. The only difference was how high the barrier was in those two bridges. Once that higher bridge barrier was put on the Ellington Bridge, it basically eliminated the jumps from there, and overall suicides were cut in half by jumping. So there's, as you might guess, there's a huge difference in lethality of means. Just over half of our suicides in the United States are committed with firearms. The next closest method is hanging or suffocation, roughly about half that. And it's noteworthy to look way down the list, roughly 2%, due to jumping or cutting yourself. So everybody has in their home a knife, right? Everyone has something in their home, a belt, a rope, or something that they could use. However, they show up far less in suicides than do firearms that are in roughly a third of all homes in the United States. So this is just a graph of how stark the difference is in lethality of means. Now, hanging is nearly as lethal as firearms, but some of these other methods, particularly poisoning, hardly show up. Their case fatality rates are so small. I'm going to go up. So there's been a few case control studies, more than a few. I want to mention one that's a national study that looked at the question of guns in a home and risk for suicide, done by Doug Weavy. Excuse me. They found that controlling for other risk factors elevated risk more than threefold by having a gun in the home. And principally those risks, as one would assume, are elevated for suicides by firearm. Very similar relationships seen in other studies as well. Of course, there can be selection issues with these types of studies. Another way to look at this is population level. Do places that have more guns have more suicides? So that's what Matthew Miller and his colleagues have looked at in a number of studies. What they've consistently found is that there clearly is a positive association with prevalence of firearms ownership and risk of firearms. That varies somewhat by age, and those at the youngest ages are affected the greatest, perhaps because more of those events are more impulsive in nature. You see this strong relationship between household gun ownership and suicide risk, not simply cross-sectionally, but you see it over time as well, which gives you a little more assurance of potential causal connection between the two. So this simply graphs the suicide rate in relation to the percent of adults in households with guns during a period where actually there was quite significant change in the household gun ownership, more so than really any time in the past 30, 40 years. So over this time period study by Miller and Company, they found in particularly a great deal of change for with lower gun ownership in homes with women and particularly with children. So the average yearly decline for children, for example, was almost 3 percentage points each year. Pretty remarkable, really. So these relationships between suicide rate and changing levels of household gun ownership after controlling for other risk factors were particularly strong and significant across the board, and particularly for youth under age 20. My colleagues and I conducted a study looking at youth-focused firearm restrictions and whether those state policies affected adolescent suicide risk. And I want to note, actually, that this was funded by the CDC even after what went down. So wanted to know. I want to give CDC credit. So look at this decline. This is really quite sharp, stark. If you look at 15 to 19-year-olds by method, how rapidly you see gun suicides reducing during the 1990s when you had such dramatic reductions in household gun ownership at a time when rates of others types of suicide methods are relatively constant. Slight increase, a little bit of substitution effect, but overall net reductions. When we systematically looked at these different policies, what we found was that laws that required gun owners to store guns safe and locked away from underage youth reduced suicide risk by 8% overall for total homicides, suicides, and that's by any method. The other firearm policies, however, were unrelated to teen suicide risk. We found that these effects did not vary by age, the ages covered, or the penalties available through state law. As predicted, we only saw the effect for firearm-related suicides, not for non-firearms. Again, suggests that perhaps there weren't other factors driving it down. The laws did not affect the age group who generally their trends seem to mirror teen suicide risk, but were unaffected by these laws, those of young adults ages 22 to 24. And again, the reductions coincided when the law started, not before. I want to note that while I'm a policy researcher, and I'm going to focus more on that side, that there is a very interesting study that was led by David Brent, who's done a lot of work in this area, documenting how much gun availability increases teen suicide risk. Because of his research, he was motivated to test out a clinical intervention for seriously depressed teens and their parents, where they were counseling people about the risk of keeping guns and suicide. In this study, which took place in the Pittsburgh area where there's a lot of gun ownership, roughly about 29% of those adolescents lived in a home with a gun. And 8 of 29, or 28%, reported that they followed the advice to remove the guns from the home. Astonishingly, a few actually acquired guns after the counseling, which is very troubling to me. So it at least suggests that there could be a clinical role here to reducing access to lethal means and saving lives of depressed teenagers. There's not a lot of good research looking at U.S. gun laws in relationships to suicide risk. There is a study that the slide does not apply to that was looked at the Brady law that showed some hint of protective effects for older individuals for reducing suicide risk. But looking at state laws that are far more robust than the Brady law, an article published in 2011 found that permit to purchase licensing was associated with significant reductions in suicide for those 45 and above. Those that are focused specifically on mental health, small effect, 3% reduction. I'm only showing the statistically significant effects in this slide. So basically, a few small effects, but the biggest effects for permit to purchase licensing. I'm out of time, so I'm going to turn it over to our next speaker.